Hello everyone, this is Dr. Ananya. Welcome to my channel. In today's video, we'll be talking about symptoms of intestinal wounds. Before beginning this video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us understand what are intestinal wounds. Intestinal wounds are also known as parasitic wounds. They can either be flat wounds or round wounds. Round wounds can include scariasis and pinworms. So, what are the symptoms of infection by intestinal wounds? As the name suggests, these are intestinal wounds, then the symptoms will be mainly related to the intestine. Some of the very common symptoms include number 1, abdominal pain. There will be consistent abdominal pain if you are infected with one of the wounds. The intensity of this pain can vary from time to time. Sometimes this pain can be very dull, while other times this can be very sharp. Number 2 is diarrhea, nausea or vomiting. If you are infected with any kind of worms, then you may experience diarrhea or nausea. Along with nausea, you may also have vomiting. Again, these symptoms can also be due to any other underlying health condition. Number 3 is having a feeling of gas or bloating. If you're infected with any of these worms, you'll always have a feeling of bloating. And this bloating feeling is usually uncomfortable. Number 4. People sometimes also experience fatigue, which means they'll always feel tired without doing any physical activity. The next one is loss of appetite. Sometimes people may also experience loss of appetite. They may not have a feeling of eating anything. And this can also lead to unexplained weight loss, which is losing weight without any intention. And along with abdominal pain, there will be tenderness in the abdomen area. Now, a severe complication of intestinal worm infection is dysentery. Dysentery means having diarrhea along with mucus and blood. In some conditions, these intestinal worms can also cause rashes or infections near the rectum, anus, or vulva. Some of the intestinal worms also cause a lot of itching, especially in your anal area. Now, the symptoms that I just mentioned are some of the common symptoms of intestinal worms. These symptoms are not specific to intestinal worms, and these symptoms can vary from person to person. Also, if you're having intestinal worms, you may not necessarily have all the symptoms. So, if you have any of these symptoms which are troubling you, then you must visit a doctor. So now, let us talk about the common causes of intestinal worms. Why do you get intestinal worms? Most of the times, intestinal worms are caused by unhygienic habits. You can get intestinal worms if you're eating uncooked meat or you're eating infected animal. It can also happen if you are consuming contaminated water. Along with this, it will also happen if you're consuming contaminated soil. People or animals who come in contact with contaminated feces may also develop this infection. And many people with poor hygiene and poor sanitation get this infection. So these are some of the possible causes of getting intestinal worms infection. So as I mentioned, if you have any of those symptoms, you must visit a doctor. Your doctor will ask for your medical history and your travel history. Your doctor may also order some tests. In all the tests, your doctor will first of all do a stool examination. It may take several stool samples to confirm the presence of worms. Your doctor may order another test, also known as a Scotch test. A Scotch test involves applying of tape several times in the anus. It is done so as in order to retrieve the pinworm eggs, which is then later looked under the microscope. Now, if worms or eggs are not detected in the stool test or Scotch test, then your doctor might order a blood test to look out for antibodies. Your doctor may also order imaging scans such as MRI, CT scan or X-ray to know the extent of the disease. If the diagnosis is confirmed, your doctor might talk with you to develop a treatment plan that works best for you. Your treatment plan will also be based on the type of worm that you have. In most of the conditions, worms go away by themselves if you have a healthy lifestyle and if you have a strong immune system. Your doctor might also prescribe you some oral medications so as to remove the tapeworm or any other intestinal worms. Also, it's important for you to follow all the instructions given by the doctor and complete the course of the medication. And try not to leave intestinal infection untreated. If intestinal worm is left untreated, then it will increase the risk of anemia and intestinal blockage. So, in order to prevent any of the complications, make sure you complete the whole course of the medication. So, are there any ways by which can we prevent the intestinal infection by worms? The answer is yes. There are many ways by which you can prevent intestinal worms infection. The very first one is to avoid eating raw meat and raw fish. Number two is you must always eat well cooked meat. The next one is that you should always wash your fruits and vegetables in a proper way, and you must always maintain a good hygiene and good sanitation. And that's all for today's video. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.